Thank you very much and good morning. I would like to thank the organizers committee for selecting our abstract. And so we started Barcelona Checkpoint like 13 years ago, and we showed that testing and treating is effective, and we could show that because we also started a cohort. And in that cohort, we showed that the HIV incidence dropped in the 9 years of following up by 60%. That same cohort also showed, and we presented those results in the EACTS 2015, that we can select within our clients certain groups who have higher HIV incidence and would benefit more of using PrEP. So I think that's an element which is important if we think about what we have discussed in the previous session about how we have to think about the design of prevention clinical trials. So after 13 years of Barcelona Checkpoint and a Spanish government which wasn't intent to approve PrEP, we thought we had to make a move, and so in the end of 2017 we opened a little bit provocative the Barcelona PrEP point, and here you see the opening. I have just some pictures. It would be the idea was to have a nice cozy place where people could come in and have access to PrEP, access to information, access to research projects. Here you can see the clinical part, Pep Coy, the doctor, Javier, he's the head of the nurses. And sometimes there's a mistake about thinking about community. I think there are two key elements. You work with peers, and that can be professionals, that can be doctors, that can be nurses, but they are key. And the second key factor is work with point-of-care technology to be able to give fast results. So what I'm going to show you is referring to the period from March 2017 to March 2019, 2 years. And during those 2 years, we had, within the context of studies, 493 persons starting PrEP, and informal PrEP users, 369, which makes a total of 862. I will come back in detail of those two. First, the studies. There are 3 studies, the Discover study, and at that period of in March 2019, 245 participants were recruited and finished their week 84 visit. Secondly, the feasibility study of the Spanish ministry. We did like more than 1/3 of the participants with 175 and 48-week visit finished. And finally, from the Catalan government study on generic PrEP with 73 participants. Now, the informal PrEP users, which is a program it's called SIGI-PrEP, which means following people who do PrEP on their own. We had given information, and this is data of March 2019 to more than 600 persons, first on an individual level, but when there were more and more people coming in, we did it on a group level. Of these persons, 369 had a visit with a doctor and the analysis done and started PrEP, of which 210 had at least 1 visit to follow up. Now, I'm aware that's from March 2019, and I tried to update this data for September of last month, this year. So in the meanwhile, we increased the number of people with information to 921. In the meanwhile, 712 2 persons not only started PrEP, but you have to think these are people who have had a visit with a doctor and the analysis done. It's not only starting, it's also starting monitoring, and 370 persons made at least a follow-up. So with the 500 of the studies, within the context of Barcelona PrEP Point, 1,200 people started PrEP already. Demographics, men, 99%, 1% transgender. You can see, and that's within the context of Spain, a very normal situation, 22% Latin Americans, and you can see also the 70% with university level. As far as the retention, within the context of studies, I don't have time to go into every study, so in the bottom line you can see the overall retention. You can see that it was around 95%. So I think it's a great retention. And if we look the reasons why people were not followed anymore within the studies, most of them were because they changed home address. Now, within the Discover study, it was possible to collocate them in another site, but with the other studies, they were lost. And only 2 persons, 0.4%, had to stop medication due to adverse events. This period, in the 2 years, we had 4 cases, 4 seroconversions. 1 person stopped medication. 1 infection was detected after 1 month, so he was probably infected during there was an infection during the window period, and 2 cases where we think the persons weren't taking adequate number of pills. Now, this is my last slide, and I go back to the cohort where we have been doing following up of people, 24,000 person years of following up, giving 2.1% of HIV incidence in people who are not taking PrEP, so in the Barcelona checkpoint. Now, of the 862 persons, what we've tried to do, and I do, is to look at the time between when they started, so the doctor visit, when they started PrEP, and the last visit with an HIV test. So all the other time was excluded, and that added up to 783 person years of following up. So in this period, with a 2.1% incidence, you should have expected 17 infections, where we have seen 4 HIV infections. Intent to treat analysis. So that means a reduction of 76%. My last slide, and I have to say that I prepared the presentation last week, so in this week you already know that PrEP is approved in Spain, so that's why it says probably... And it really was a difference, and before and after when Dr. Julia D'Alamo came into in the office of the ministry. But knowing the situation in Spain, you have to be aware that the approval at the state level implies the price and reimbursement issues. But the implementation will be done at the level of the autonomous communities. And as you can see here, we have 17 autonomous communities, and they will follow the same rhythm, each of and every one of them. I can tell you that in Catalonia, we have been working with the Catalan government for more than 1 year, just foreseeing the situation and talking about implementation. So I hope that we will be able to get out PrEP as soon as possible. Finally, I wanted to say as a next step also, it's important to increase the number of transgender women and also to look after young MSM, especially below 25 years, because I think this will be the group which aren't pronounced to start with PrEP, and where we will see the new HIV infection. So we have to think about programs which are not only concentrated on PrEP, but are a mix of, let's say, programs where you have HPV vaccination with PrEP, combinations. So with this, I would like to finish and thank all the staff and volunteers and you for your attention. Thank you.